This conference will now be recorded.
And I'm going to change it to show me who's talking instead. I think is what I need to do. And I see Philip has arrived. Hi, Philip.
That's me. Yes, hello. You know,
Cool.
I will do my best. I thought this was a Zoom call and I had everything ready, so I've never played videos and all this stuff on one of these, so we'll do our best for you guys.
You should be okay. Just when you throw up your presentation, just share your screen.
Yeah, okay.
It's pretty simple.
I got you. I've got like 3 or 4 different things, so we'll get it done.
Okay.
I'm a perfectionist. I apologize. And I go by Sam. Philip is the legal name. It's Philip Samuel.
So, Marty,
Hi.
how do I get the audio somewhere other than on just the little laptop? Can the audio come out there?
Your computer's hosting the image, so I don't think did you run the audio up on the remote?
There's an HDMI, but I don't know how to do that.
Is the TV volume available with the remote there?
Yeah, but it doesn't do anything.
Okay. Yeah, well, shoot.
It's still coming out.
It's because the way to switch it.
I don't know how to do that.
I'm trying to figure it out here on the fly.
Oh, awesome.
I would think because your input source of the TV is your HDMI, and the audio should be.
And Amy can't hear.
Should we use the speakerphone instead of the computer?
Do you have the spaceship?
Yeah. We'll go to outer space together.
All right. We're going to try to fix an audio issue here.
Okay.
Right now, the audio is only coming out of the laptop, so we're going to get a phone in here and switch. Put a speakerphone on the table.
Okay.
Give us just a second.
There we go.
It'll be just a couple minutes, everybody. Thank you for being patient.
I'm unpinning my camera is being used by Zoom, so I'm trying to get that off.
Uh-oh.
Yeah, that's all right.
There's Amy.
Hey, can you hear me okay?
Yeah.
Awesome. I know I got on and I could see you, but I couldn't hear anybody, so.
Brian.
Okay.
It'll be just a minute. We got to get our speakerphone in here.
How's the weather at the coast today?
We are pretty much socked in. It's not. We've been socked in for days. The sun comes out in the afternoon for a while, but our mornings are pretty much this inversion thing.
Oh.
I like it.
You live in the right place. I don't want to make anybody jealous. We're having a lovely, like 70, upper 70 degree day in Portland. So it's kind of blue skies. Yeah, blue skies.
Sounds perfect.
Yeah, it's nice. Depends on your perspective, Jane, I guess, since you like the rain.
It's not raining. It's just nice and cool. Watching eagles over the river. Come on.
Wow. Oh, good.
And there's 9 ships right now. 9 ships out there waiting to go upriver. I'm assuming they're waiting to go up.
Have you guys had some cruise ships landing now that COVID's kind of, or not?
I don't think we've had cruise ships yet, have we?
Well, we had 1 or 2.
We did have about a month ago.
That little cogwheel,
Okay.
right?
Yeah.
You see the
School buses.
USB-C audio speaker. What's the speaker?
Philips TV.
Yeah.
Okay. Amy, talk to me.
Hello. Can you hear me? Ooh, it's an echo. But you're on mute, Jane. Oh, maybe you want to be.
I may want to be. I think I'd have an echo too. Yep.
Now she's gone. She's on mute.
She's working on her audio.
Okay.
Okay, that's a bit.
Turn ours down a little, too.
Oh,
Because your PC is going to pick up what he's saying to the TV.
yeah, so I do want to mute the mic. I'll make this call real quick. Okay, so are we ready?
I have plan B.
Okay, let's go ahead and give this a try. I'm gonna have to trim this recording up, obviously, but I'm gonna go ahead and mute and turn it over to Karen. Welcome, everybody.
Before you do, can you make me a presenter, please?
And let's see.
This is Sam. Philip.
How do I do that?
That asked the organizer to make you a presenter.
Okay, help me out here, Marty.
Yeah, sure. I've never done one of these, so remember that. I'll tell someone to do something. Like, go ahead, Jim. Allow.
Let's see. And so who am I turning into a presenter again?
Sam or Philip, either one.
Philip.
Yep.
Make presenter. There you are.
Verify.
Yes. All right. You are the presenter.
All right.
And now how do I mute everybody? Everybody, it looks like everybody's already muted, so we're okay. Except for Philip and Ryan. No, this is his presentation. Thank you so much to Karen and our presenters today. I will let Karen do the introductions. And I hope you brought your questions with you. There's a whole lot of gotchas to this, at least from what I've experienced so far. So I will turn it over to you guys. Thank you so much.
Thank you, Jane. Yeah, my name is Karen Demas. I'm with Assured Partners, and we are your employee benefits broker. So we specialize in group benefits, and because we are discussing Medicare today, we wanted to bring in some Medicare specialists. So you're going to be speaking with Ryan and it's Sam. It's going to look like Philip up on the screen, but Sam from Keenan Direct. They are a sister agency that specializes in Medicare. So they're going to go over a presentation with you and then give you time to answer some questions after.
Great. We're looking forward to being here. I'm Sam Cole. I do a lot of CE classes on GoToMeeting, and so Philip Samuel is my real names, but I go by Sam. I'm the third. And Ryan DeLay is with us. He is our Medicare expert here at Keenan Direct. And what we're going to do is walk you through using some videos and some question and answer. We'll talk about Medicare made clear. I understand there's some folks that want to continue working past age 65, and we've got a little video about that. We feel free at the end of each segment, we'll have question and answers, and then we'll get in and talk about the difference between VIBA and HSA and kind of see what your options are out there. And to get started, I'm going to bring up a video called Medicare Made Clear Basics. It's from United Healthcare. It's not a commercial. They do a very good job. They're probably the largest Medicare supplement provider in the country. They do all of the ARP plans, but they have some great infomercials out there on YouTube. If we don't answer your questions, they have this whole series called Medicare Made Clear. You can go there on YouTube and watch any segment. It's very informative. So I'm going to escape this one, and I am going to bring up this one. And just sit back, and this is about 12 minutes.
Hey, Sam, I'm not getting the audio on the video.
Yeah, no audio.
Because a strong foundation in the basics is going to help you understand your choices and make better Medicare decisions for yourself.
Can you hear that?
We'll start at the beginning and talk a little bit about what Medicare is and who can get it. Then we'll talk about the parts of Medicare, what they cover, what they cost, and then we'll go into how to put those parts together to come up with coverage that works for you. So let's get started. Medicare is a federal health insurance program for people 65 and older and others who have qualifying disabilities. You also need to be a United States citizen or a legal resident. If you're a legal resident, you need to have lived in this country for at least 5 years in a row, including the 5 years just before you enroll in Medicare. Another important thing about Medicare is its individual insurance, meaning every individual person needs to qualify for it themselves, enroll in it, and choose coverage for themselves. This can be different from what you're used to if you've had a family health plan through an employer, for example. Government-sponsored Medicare is made up of two parts, Part A and Part B. Each part covers certain healthcare services. The two together are often called the original Medicare, or sometimes traditional Medicare. There's also a Part C and a Part D, and Medicare supplement insurance. And we'll get to those in a little bit. So let's start with Part A. Part A is hospital insurance. It covers inpatient care when you're in the hospital or a skilled nursing facility. It covers your room, your meals, your nursing services when you're in the hospital, any equipment or supplies that are used in your care, operating room, whatever the needs are that you have while you're in the hospital or in a skilled nursing facility. Medicare Part B is medical insurance. It covers your doctor visits or your doctor services even when you're in the hospital. Other things covered by Part B include care when you're in an outpatient facility like the clinic or the emergency room, for example, ambulance services if you need to go to the emergency room, preventive care services like flu shots, medical devices that you might use at home, such as a wheelchair. Original Medicare, again, has Part A and Part B, and it does come with some costs. Those costs can include premiums, deductibles, copays, and coinsurance. Let's start with Part A. Part A, in fact, is premium free for most people. If you've worked and paid taxes, or your spouse has, for at least 10 years, then you get Part A premium free. Otherwise, you would have to pay a premium. Other costs for Part A include a deductible and some copays and coinsurance. But importantly, you only pay for Part A when you're actually receiving Part A services, such as when you go in the hospital. So Medicare Part B does come with a premium, and that will be deducted out of your Social Security check if you receive Social Security. Otherwise, you'll need to pay it directly to Medicare. Other costs with Part B include some copays, a deductible, and some coinsurance. For most services, you pay 20% coinsurance, and that means you pay 20% of the Medicare approved amount for that service, and Medicare pays 80%. So we've talked about original Medicare, Part A and Part B, what they cover and what they cost, but they don't cover everything. Neither Part A nor Part B covers prescription drugs, for example, dental or vision or hearing care. This is where Part C, Part D, and Medicare supplement insurance come in. They offer you more coverage options. Let's start with Part C. Part C is Medicare Advantage. Medicare Advantage plans are offered by private insurance companies. They cover everything that original Medicare covers, all of your Part A benefits and Part B benefits. In addition, most plans will include prescription drug coverage and additional benefits like dental and vision coverage. The cost for a Medicare Advantage plan might include a premium or it might not. There are some plans that have $0 premiums. Other costs would include copays for services you receive and sometimes a coinsurance. Another important thing to know about Medicare Advantage plans is that they are required by Medicare to set an annual out-of-pocket limit. This out-of-pocket limit is like built-in financial protection, because if you reach that limit, the plan would pay all of your costs for the rest of that year. There may be many Medicare Advantage plans offered in a region or a state or a county, and each one will have its own coverage and cost terms. Now let's talk about Medicare Part D. Medicare Part D is prescription drug coverage. You can get prescription drug coverage in two ways, either through a Medicare Advantage plan, like we just talked about, or through a standalone Part D plan. You can always remember prescription drug plans and Part D by thinking D is for drugs. Medicare requires that Part D plans cover all the types or classes of drugs that are normally used by Medicare beneficiaries. Every plan has a formulary or a list of covered drugs. So when you're choosing a Medicare Part D plan, it's really important to look at those formularies and make sure that the drugs that you take are on those lists. Costs for a Medicare Part D plan vary from plan to plan, but it usually includes a premium, and you'll probably pay a copay when you fill a prescription. What you pay in copays, again, depends on the plan and also on the formulary. Every plan places certain drugs on what they call tiers or levels of a formulary, and the level determines what you pay at the pharmacy counter. Usually the higher the level or tier, the more you'll pay. Costs for Medicare Part D will vary from plan to plan, but most plans have a pharmacy network. And if you fill your prescriptions within that network, you're going to get the best price for that prescription. Medicare supplement insurance is also called Medigap, and it's just what it sounds like. It supplements Medicare. Medicare supplement plans help pay some of the out-of-pocket costs that come with original Medicare Part A and Part B. These can include premiums, deductibles, copays, and coinsurance. Medicare supplement plans are standardized. They're labeled from A through N. There's 10 different plans with varying levels of coverage. For example, one plan might cover copays and deductibles, and another plan might cover copays, deductibles, and your premiums. So each Medicare supplement plan that has the same letter offers exactly the same coverage. However, plans may differ in what they charge. So a plan G, for example, in one state may be a different price from plan G in another state. The main purpose of a Medicare supplement plan is to cover the costs that come with original Medicare Part A and Part B. However, some Medicare supplement plan providers do offer additional programs that can provide discounted services for dental or hearing or other healthcare services. Medicare parts and plans can work together in different combinations to offer you the coverage you need. It really comes down to two scenarios. You can keep original Medicare Part A and Part B and decide to add prescription drug coverage and or a Medicare supplement plan, or you can choose a Medicare Advantage plan instead, which encompasses all of the coverage in one plan. Medicare supplement plans work only with original Medicare Part A and Part B. If you have a Medicare Advantage plan, you don't need and you can't use a Medicare supplement plan. People often ask, how do I know what's right for me? What Medicare plan should I choose? Well, that choice is personal because your health needs are personal, and each person needs to make a decision for themselves. There are a few things to think about as you look at Medicare plans and coverage in general. One, Would you like to have additional benefits like dental or vision? If so, then a Medicare Advantage plan might be a better choice because they offer these options, whereas original Medicare doesn't. 2, would you prefer to have lower monthly premiums and pay as you go, so to speak, when you go to the doctor with the copays? Or would you prefer to have higher premiums and fewer copays or out-of-pocket expenses? In the first scenario, a Medicare Advantage plan might be your best choice because premiums are low and you pay only when you receive services. In the second case, original Medicare with a Medicare supplement plan might be a better choice because your premiums may be higher, but you'll pay less out of pocket as you go along. Number 3, do you have specific doctors or providers you like to see? Or do you travel frequently? If you do, original Medicare might be a good choice for you because every provider in the United States is covered. Medicare Advantage plans often have a provider network, and you need to choose providers from within the network to get the plan's best prices. So there you have it. That's the basics of Medicare. And if there's just one thing that you take away from today, I hope it's this. You get to choose. You get to choose Medicare coverage that fits your health needs, your budget, and your lifestyle. If you need more information about Medicare basics or other Medicare topics, please visit us at MedicareMadeClear.com and follow us on Facebook for answers to your Medicare questions and regular updates on Medicare topics. Thanks so much for listening.
Okay, can everyone hear me now? How was that? Did the audio finally kick in there?
Yeah, it was great. Thank you.
Okay,
At least here, we were okay here in the conference room.
So Ryan is my expert. The one thing the video didn't say, or it didn't say it directly, is by and large, like Kaiser offers a Medicare Advantage plan. You're usually restricted to about a 50 to a 100 mile radius around there for your normal coverage. It's an HMO. On Medicare supplement, that basically is PPO. You can go anywhere you want to go. And with that, Ryan, I'll let you add anything, and then we'll take questions for a couple of minutes if anyone has any.
Yeah, the video did explain it pretty well. Basically, the Advantage plans, generally HMO policies, smaller network, but more affordable and typically includes prescription drug coverage. Supplement, have a higher monthly premium, does not have prescription drug coverage, that's completely separate, but gives you tremendous flexibility where you can go anywhere that accepts Medicare. But yeah, definitely let me know if there's additional questions about how Medicare works, and can certainly help you out.
Any questions? This is a good group. So one of the things that I talked early on, go ahead.
Sorry, we do have a question. Hopefully you'll be able to.
Sure. Hi, I'm Marty with Clatsop County. I was speaking with some other agencies, and I was advised that the Medicare plan, the Advantage one, wouldn't be good for our demographic because there's not too many physicians in that system here at Astoria. Does that sound true?
Yeah, specifically for Astoria, Advantage plans are pretty limited. With Medicare Advantage plans, as far as what's available is dependent on basically where you live or your residential zip code. There's only 2 in total plans available, and so definitely some limited options. Most likely, most people will want to go, at least specifically that anyone that lives in Clatsop County will want to go with a Medicare supplement because that's going to give you the opportunity to have access to most doctors. Now, if anyone living somewhere else, there may be more options, but yeah, there's not that many plans as far as on the Advantage side available for your area.
And Brian, we'll answer your question in just a little bit later, but we'll be able to help you with that. I just saw your question pop up. If that's okay. Any other questions? Go ahead, sorry.
Yeah, as far as for actual plans, yeah, that's exactly what we help out with, is help shopping for plans. Rates are going to be dependent on, you know, where you live, your age, and when your Medicare either went into effect or will be going into effect. So yeah, rates can be kind of specific to each person's needs, but that's absolutely what I can help out with.
Okay. One of the things that early on Karen and Amy and I discussed was that some of you folks, and even like, I will be honest myself, we're going to work past age 65. And this is a video that I think will take a few minutes, but I hopefully it'll let you know what avenues you have to pursue if you're going to continue working past age 65. See, that was so quick.
I'm Phil Moeller. Thanks for spending a few minutes with me today. As a journalist, I've written a lot about healthcare and retirement over the years. As an author, I've done consumer guidebooks to Social Security and Medicare. So, not surprisingly, I get asked a lot of questions by readers about how these programs work. The question I get asked most frequently is, I'm nearing my 65th birthday. What the heck do I do about Medicare? And the answer, of course, is it depends. So I want to break that down for you today and describe the various situations that can affect somebody who's nearing their 65th birthday. So the first decision is for somebody who's nearing the age of 65 at work, and they do plan to retire when they turn 65. So in that situation, the first thing I advise people to do is sit down with their employee benefits department and find out if they have any kind of retiree coverage that's going to kick in when they retire and leave their active employer group coverage. In many cases, they may have some retiree coverage. They need to understand this because even if they have retiree coverage, they still might need Medicare to provide full coverage of their health needs when they retire. In some cases, a retiree program can provide secondary coverage, and so they would need to get Medicare and they'd use the employer program as secondary coverage. So in a lot of situations, of course, there is no employer retiree coverage and you pretty much are going to be relying solely on Medicare. In that case, as a new enrollee in Medicare, you will have a 7-month initial enrollment period that begins 3 months before your 65th birthday month and then extends 3 months past that date. So you have a 7-month period to sign up for Medicare. Complying with this enrollment period is important because if you're late in that, you might face late enrollment penalties. They can last the rest of your life, and you really don't want those if you can avoid them. So that's really important, but it's not nearly as important in my view as making sure that you have continuous health coverage. So as an example, say you lose your employer coverage at the end of June, you still have several months to sign up for Medicare, and you say, I'm within that initial enrollment period, I'm fine. But you're not fine because you might have a lapse in your health coverage. So I advise people to find out again when their employer coverage is going to end and make sure that they enroll in Medicare early enough so that they don't have a break in coverage, because that's the thing you don't want. I would always err on the side of making sure that you have coverage. The other issue, of course, if you are this employee and you're going to lose group coverage when you're 65 is to make sure you understand the coverage needs that your spouse may have, or perhaps you have a child or more than one child that's insured on your group policy. You're going to have to work to make sure that they're covered when you lose your employer coverage because you're retiring. The other situation is that you're turning 65 and you have no intention of not working. You're going to continue to work. And a lot of people do this. Increasingly, people are continuing to stay at work past the age of 65. So in that situation, there are sort of two pathways that can affect people. The first pathway exists for those people who work for small employers, which in this case are defined as people with 20 or fewer employees. So if you have fewer than 20 employees, in most cases, your employer plan will require that you get Medicare when you turn 65. In that situation, usually the employer plan reverts and becomes a secondary insurance provider, and Medicare becomes your primary insurance provider. If that's the case, then you have some decisions to make about what kind of Medicare to get. And this is why it's important for you to understand what your employer benefits are going to continue to be when you turn 65. Another key thing you need to worry about in this situation is your drug coverage. When you turn 65 and get Medicare, it's important to understand whether your employer is going to offer you any kind of drug coverage. In this case, the employer drug coverage has to be at least as good as Medicare. In that situation, the employer will tell you that, and you don't need to worry about getting a Part D plan. So there are a lot of retiree programs that do provide some kind of Part D coverage, and you need to find out these details. If you have a spouse that's covered on your plan or children covered on your plan, in most cases, they should continue to receive employer coverage. You may have to get Medicare, but they will still be covered on your employer plan. However, I always urge people to make sure that they talk to their benefits people ahead of time. A lot of Medicare problems occur because people don't do this ahead of time. They sort of wait until after the decisions have been made, and if there's an adverse decision, it can be very complex and time consuming to fix that. So the best thing to do is not have the problem in the first place and do your homework ahead of time. Going back to the two pathways I mentioned, the second pathway occurs for people who work at larger employers that have more than 20 people. The Medicare rules in that situation require the employer to continue offering you group coverage when you turn 65 and continue offering you group coverage regardless of how old you are, as long as you're an active employee and covered by that plan. So in this situation, you have another set of decisions you can make. They can be complicated, but they don't need to be. Again, I would urge people to begin by saying, go to your benefits folks and understand how your employer plan may work or complement Medicare coverages that are available to you. Traditionally, employer coverage was pretty good. Employers paid a large percentage of your overall healthcare costs. And the easy and sort of default decision was, well, I'm not going to get Medicare because I've got a great employer plan and I don't need to get Medicare. And that may still be the case, in which case you can not get Medicare at 65 and continue with your employer plan. However, more and more people have been getting high deductible health plans at work. These can require you to pay up to several $1,000s out of your own pocket before your employer plan starts to kick in the benefits. In that case, you may want to consider whether you get Medicare in addition to your employer plan, because as secondary coverage, Medicare can help pay that deductible amount of money that otherwise you would pay out of your own pocket. In that situation, obviously, you have to look at what Medicare will cost you and what its benefits will be in helping you as a secondary source of coverage. So Again, you could decide to keep your employer plan and get Medicare. The last possibility is that you can also decide, well, maybe I just want to rely on Medicare and not have an employer plan. Medicare's coverage can be pretty complete. You look at the cost of your employer plan, look at your annual out-of-pocket exposure, and look at employer plan versus Medicare, or as I said earlier, employer plan plus Medicare. But in this context, you might want to just say, well, I think I'm going to drop my employer plan and rely solely on Medicare, which you can do. Keep in mind that you should, again, talk to your benefits folks and make sure there aren't any unintended consequences of doing that, and that the employer plan is set up with flexibility to allow you to drop it. The related aspect of that, of course, is that you may not be the only person insured on that employer plan. So in that context, if you have a spouse or children that are covered by your employer plan, you want to make sure that they're still going to be covered, even if you drop the employer plan. This can be a little bit more complicated. Again, I urge people to sit down and talk to their benefits people and work out the details and make sure that they're making an informed decision. Another question I get asked a lot is, how does Part D coverage work if you're going to keep your employer plan when you turn 65? This is, again, an issue that a lot of people don't understand, but under Medicare rules, if you're eligible for Medicare, meaning you're 65 or older, and you're going to keep your employer coverage, that employer coverage has to offer drug protection that's at least as good as a typical Part D drug plan in Medicare. Again, historically, this was sort of a no-brainer. Employer drug coverage was pretty good, and you didn't really have a credibility issue with it. However, the rise of high deductible health plans means that in some contexts, your effective drug coverage is not nearly as good as a Part D plan. The Part D annual deductible is never more than several $100s, and so you could have a health plan with your employer where you could be paying a couple $1,000s for drugs out of pocket as part of that initial deductible in your employer plan. In which case, it might be that your employer plan is not credible and you'd have to get Part D. Now, your employer is required under law to provide you an annual statement as to the credibility of its drug coverage. I've never met an employee who even knew that such a statement existed, let alone whether they should ask for it. But you should, because if your drug coverage is not credible and it turns out you needed a Part D plan and you failed to get one, you could get hit with late enrollment penalties later on when you ended up having to get Part D and you ended your employer coverage. But the other reason to do this is because you could be much better off financially and have much better coverage having a Part D plan along with your employer coverage, because that Part D plan could really help pay for some of the drugs in this deductible portion of your employer group plan. So in addition to sort of the basic pathways that you have to choose, there are a couple of other situations I wanted to review that affect a lot of people based on the reader questions that I deal with. The first one involves what's called COBRA. COBRA is an acronym for a law that was passed in the 1980s that provides people guaranteed access to health insurance if they lose their employer insurance. It can be continued for up to 18 to 36 months, and for a lot of people, COBRA is a great deal. It really relieves a lot of stress if you happen to lose your job. You got a lot of worries about not having a job, and one of them you don't want to have in that group is whether or not you're going to have health insurance. So COBRA allows you to continue your health insurance. However, for people who are nearing age 65, there's a wrinkle in the COBRA rules that a lot of people don't understand, and that is that if you're on COBRA and you turn 65, COBRA will cease providing primary insurance coverage to you and will become a secondary provider of insurance coverage. A lot of people don't know this and assume that COBRA is going to be their primary insurer, and because they have COBRA, they further assume that they don't need Medicare at 65. They fail to enroll in Medicare, and in that situation, they could face a really unpleasant surprise if they have a big medical expense and they file a claim only to learn that COBRA is only going to be secondary coverage. It's not going to provide primary coverage. That can entail a big financial hit if you have a serious medical issue. So I urge people to be aware of the fact that if you have COBRA and you are eligible for Medicare by virtue of turning 65, you have to get Medicare on a timely basis because COBRA will no longer be your primary insurance provider. The second situation that arises in these Medicare at 65 decisions is for people who have a high deductible health plan. If you have a high deductible plan, many employers will help you set up a health savings account to help you deal with those expenses in the deductible phase of your plan. HSAs are funded with pre-tax dollars. Usually your employer puts in some, and you can put in the rest up to a specified annual limit that is set and changed every year by the IRS. Not only can you fund it with pre-tax dollars, but you can spend those dollars on any qualified health expense, and you will not incur a taxable event when you spend the money. So HSAs can be a great vehicle because they're rare in that they're funded with pre-tax dollars, but when you spend the money out of the account, it's not a taxable event. So it's tax-free going in, tax-free going out. It can be a great tool. And the other nice thing about HSAs is that if you have unspent monies in an HSA, you can carry them over from year to year. So you can build up some pretty big balances in an HSA. And I've actually advised people in some settings to not use their HSA. Just use it as almost a retirement vehicle, build up big balances in HSA. So when you do retire, you can spend those balances tax-free on any qualified expense, including, by the way, Medicare premiums, which are a qualified medical expense when you retire. So HSAs can be terrific. However, there's a wrinkle in that HSAs are not compatible with Medicare. So if you have Medicare, you are no longer allowed to contribute to an HSA. You can use the funds in the account, but you can't contribute new funds to the account. And your response may be, well, that's fine because I'm going to continue to work and I'm going to continue to use my HSA and I'm not filing for Medicare. However, a lot of people as they get older, especially when they reach the latest claiming age of 70 for Social Security, it really behooves them to file for Social Security. When you file for Social Security, by law, you must receive Part A of Medicare. You can't avoid it. If you want to get Social Security benefits, you have to be enrolled in Part A. If you're enrolled in Part A, it means you can't continue making contributions to an HSA. People rarely understand this. I get a lot of questions from people who simply are surprised when they run into this roadblock. And so I'm telling you today that there is a roadblock you should be concerned about. So you shouldn't unintentionally enroll in Part A. And in some cases, it can influence the timing of when you do apply for Social Security. However, I don't know of any situation when you're better off not taking Social Security benefits and using the benefits of contributing to an HSA, especially if you're waiting until age 70 to file. You should just file for Social Security and understand that that means you won't be able to continue contributing to your HSA. So the COBRA and HSA situations are issues that catch up a lot of people, and I just wanted you to be aware of it. I get asked a lot of questions about how people enroll in Medicare. And some people think that they are automatically enrolled in the program when they are blowing out the candles on their 65th birthday cake. This is not the way it works. When you turn 65, you need to actually affirmatively enroll in the program. And there are multiple ways you can do this. Social Security handles Medicare enrollment, so you can call the Social Security Administration or go online, but you can also work through Medicare.gov, and they can help facilitate your enrollment in Medicare. But again, remember, this is something you have to do when you turn 65. It won't be done for you. I really appreciate you spending a little time with me today. I hope I've helped answer some of your Medicare questions. I realize you may have lots of other questions. Medicare can be pretty complicated. MedicareMadeClear.com provides lots of answers to your basic questions. So if you still have them, I urge you to go there and see if you can get the answers you need. Thanks again for spending time with me today.
Okay. I hope that was informative. I think it had a lot of information that was pertinent to what we had discussed. There was a shorter version, but that one got into the HSAs and high deductibles and things like that. So at this point, I'll open it up for Ryan, Karen, Jane. Any questions on that before we move on? I know there was a lot there too.
Oops, sorry. Yeah, there was a lot. The conversation here is our CIS plans do not allow us to have both Medicare and coverage with the CIS plans. Is that correct, Karen?
Amy, go ahead. I believe you can, but it's just whether it's the best option.
The issue that that you're thinking of, Jane, was when we offered only the high deductible plan with health savings account, maybe, and maybe that one doesn't coordinate well with Medicare, so we really weren't recommending folks to have both, because when you get the Medicare, keeps you from being able to contribute to your health savings account if you're in Part B. So at that point, when everybody at Clatsop only had the high deductible with health savings account, which most of you are on that plan, that's the bulk of the enrollment. It's just not really advisable. It's not that that you can't do it, I suppose.
And then if we continue with the employer plan, we've turned 65, we're Medicare eligible, but have deferred Medicare, we can still no longer contribute to the HSA and we need a VIBA. Is that true? Or can we still have the HSA and contribute to it past 65?
If you remain on the employer health plan, you can continue. If you enroll in Medicare, that you cannot contribute to an HSA. Am I correct, Ryan and Amy? So
yeah, if you can with the employer plan, then you can kind of continue on that policy and contribute as you have. And it's kind of once you retire or no longer on that specific plan, you can use the funds that are in the account for your Medicare, but at that point is when you'll no longer have the opportunity to continue to contribute to the account.
And that's an IRS rule based on the high deductible, what makes a qualified high deductible plan, and allows you to be able to put those funds in pre-tax to make your own contributions and receive the county's contributions. You can't do either of those things if you could take Medicare.
Can I ask him?
Sure.
Hey, this is Marty from Clatsop County again. I was reading in the HSA contribution piece, and I think it said you had to stop contributing 6 months before you elect to go on Medicare. Is that true?
Yeah, that sounds right to me as well. I was going to mention that. It says you only have a certain amount of time. I believe you're right, 6 months before you're going to enroll, you have to stop making those contributions.
Yeah. You want to stay eligible for that health savings account for the majority of the year that you've funded it. So once you take Medicare, if you continue to, yeah, that's correct.
So
if I put in $25 a month, I have to stop that 6 months before I retire.
I think it just becomes taxable, doesn't it? If you do it after the 6 month window. That sound right?
Let's see.
That's the only complication. I believe it's a taxable event if you contribute to your HSA after the 6-month window of not contributing. Does that make sense?
Yes, and there is a penalty also associated with that if you were audited, and so it's a tax and then a penalty. I think it's like 20%.
So I guess basically when you decide you're going to retire, you need to kind of do it at least 6 months before your decision date takes effect and stop these HSA contributions with our particular environment at the county.
Yes, I think it's worth, and this is Jane, I think this is a great time to have these meetings too, and just kind of make sure folks who are impacted by Medicare eligibility are getting the message frequently. Just, yeah, work with Jane, notify the benefits folks, and then you can kind of make sure all your options are laid out. I know in the past, and Jane, I don't know if you guys are still doing this, but if you were in the, because we formerly only had the high deductible plan with HSA, when folks turned 65 that were still actively working, we were doing VIBA contributions for them instead of HSA. I don't know if we have the PPO option now, so I don't know if we're still doing that,
But we are still, there are some employees who get their contributions into a VIBA.
instead of an HSA. So that's the other alternative.
So,
I don't think that's a limit on when you stop putting it.
well, you can't personally contribute pre-tax to a VIBA, only your employer can.
I see.
So the $2,000 that we would normally put into an HSA goes into the VIBA instead in January. So
If you apply for this, or is it the age 65 that you have to convert to?
that's the kind of my question.
Mm-hmm.
Is age 65 the eligibility for Medicare based on your age? Does that trigger, no, you can't have an HSA, you have to go to a VIBA? Or can people continue to carry their HSA and contribute to it and benefit from the tax-free part of that?
So my understanding, and I'm curious for Ryan's opinion about this, is that once you have Part A, which is not auto covered, that it makes you ineligible. But then they were saying in the video, I'm learning because I'm not a Medicare expert, which is why we have Ryan here today, and Sam, that if there's no cost for it unless you use the plan, maybe it's not that disqualifying. Can you speak to that, Ryan?
Well, yeah, I will double check that as well. But I guess my understanding was that for as long as you're still enrolled in the high deductible health plan, you would have that opportunity to continue to contribute. If you choose to delay getting your Medicare Part B until you retire. I guess we'll want to confirm that. I mean, that was my understanding, is that if you're still on the high deductible, that gives you the opportunity to continue contributing as long as you delay getting your Part B until you retire.
See, and I really need clarification on that, because we have a supplemental enrollment document that new employees sign. It's an understanding that says if they enroll for any part of Medicare, A, B, or D, they can't have an HSA.
Yeah.
We'll get that clarification for you, Jane, if that's okay. We'll have to go to CMS. We can do that. Okay.
Great. Thank you.
Let's, in the interest of time, we want to move on, and then we can keep your questions there. I'm going to turn it over to Ryan. Just a few things, the differences between a VIBA and the HSA. If that's of interest to everyone.
Yes, thank you.
Ryan?
Yeah, so kind of like with the different bullet points that are outlined here. So the HSA is tied to the high deductible, where you can be on a VIBA and doesn't necessarily have to be a high deductible. That specifically is kind of up to the employer as far as what the benefits that they're offering. HSA does allow you where you can withdraw money from that account, but kind of like we mentioned earlier, is where you can have the different tax issues as far as doing that if you use the services or the funds for things outside of premium when you're 65 or medical out-of-pocket cost. Viva has to be towards the medical expenses and doesn't give you that cash option. Again, if you have an HSA, if you do take the cash option, you have those tax issues that come along with that. And then, yeah, HSA has the contribution limits on a monthly basis, on an annual basis, whereas Viva is kind of up to the employer as far as the amount that they can contribute. And then also, like we discussed, with an HSA, it gives you the opportunity where both the employer and the employee can contribute to the HSA, but just the employer to the Viva. So kind of some of the biggest differences between an HSA versus a Viva.
I'm attempting to change the slide for you, Ryan. It doesn't want to let me, so hang on. There. Okay, there you go. Sorry about the technical glitches, but we're getting there. Ryan?
It's kind of following the bullet points. If you're no longer employed for the employer who put the money into the Viva account, the Viva does become part of the post-employment or the retirement Viva. And so that's where the employer must contact further to change the status of the Viva from active to post-employment or retirement. So you can use it for the insurance premiums and any of the out-of-pocket costs that you would run into in addition to the premiums for a new plan. Other standalone type policies for dental or vision or other benefits, other policies that are not under the guidance of the Affordable Care Act. Individual and family insurance premiums for plans purchased through the exchange without a subsidy. Additionally, Medicare premiums, as long as as Medicare is a secondary payer rules. So the post-employment or retirement Viva account does not cover things like insurance premiums for medical purchased through the exchange if you have a subsidy. So that's like the Affordable Care Act plans or the Obamacare type plans. If you have a subsidy, it's where you won't be able to use like the retirement Viva. I don't know, is there the next slide?
This slide, I wanted to turn it over to the experts, Amy, Karen, Jane, and Ryan, to kind of walk through this if you could. I did not have a lot of the specifics ahead of time, and we can answer questions or just you can go through it rather quickly if you'd like.
Yeah, thanks, Sam. And we kind of were chatting a little bit earlier about the plans that the county offers. So as you're thinking about your options, just know that you have each person that works at Clatsop County is offered the choice of a PPO plan or the high deductible plan with the health savings account. There is an employer contribution to the HSA. I don't think everybody has access to a Viva, right, Jane? That's just in some circumstances, Vivas might come up.
The Viva is for AFSCME members that choose the PPO. We offer a Viva solution because they have a flexible spending account that they have access to. But the VIVA otherwise would only be for folks who are no longer qualified for an HSA, 65 or older, or for some other reason not qualified.
Yes, there are other reasons. Good. I know we're focused on Medicare, but there are other reasons that a person may not qualify for HSA contributions. So if you're in that situation where you have the VIVA, just you're aware of that. So, so those are kind of the active, health coverage plans that you have through the county. And the PPO is the newest plan, so it's only been around for 2 years, I believe. So you might be less familiar with that. I know we've done some education meetings on it recently. Anybody have questions about the CIS plans that we have?
Sure. Yeah, there's a question about VIVA contributions from Marty.
Yeah, hi, it's Marty from Clatsop again. On the VIVA gig, if you're forced into that for whatever reason, is the employer the only one allowed to contribute, or is there any way a post-employment contribution can be made? Yes or no?
Yeah, to my knowledge, VIVAs are employer funded only. So that's the limitation on, it's considered a health reimbursement essentially. So it's always employer funded. You can't intermingle employee dollars in that account.
And there's no way to add to it if you are separated from your employer.
Right.
Is that correct?
It's the same way.
Yes. Yes, that's correct.
Okay.
But it would be taxed money that you're putting into it.
Right. You can still contribute to HSA out of your pocket if you wanted to.
Just to clarify, you can still contribute to an HSA if you want to, you just don't have the tax-free benefit at that point. It would be tax money that you're putting into it.
It would be subject also to a penalty. So we wouldn't, again, well, okay. I wouldn't recommend putting money in your HSA. You're just asking for an IRS audit, I think, in that circumstance. I'm not sure, honestly, if the bank, it might be variable by banking arrangements if they allow you to just fund it, even if you're not in the right plan.
So basically, once you retire and need you deplete whatever fund you have.
Right.
HSA, or
They're gone.
you're out.
But you still use your HSA balance after you retire, whatever's left there, you can use it without penalty.
Absolutely. You can separate from the county, go work somewhere else. It stays with you. It's your bank account.
Right.
Yes.
Either one, VIVA or HSA. Yeah.
Yes. Both the VIVA and the HSA. One of the things that we tell employees, you have this maximum limit on your HSA. The county, if you're a family coverage or employee plus coverage, you're receiving $2,000 from the county every year into your HSA. If you wanted to avoid that little monthly fee that the bank pulls out, you can contribute money into it. It's just money that you probably got that was already taxed. But a lot of people don't like the bank taking that fee out, so they contribute to it. And when you're 55 and older, you can still make a catch-up contribution of $1,000 every year. So you just have to adhere to that IRS limit, annual contribution limit. Is that accurate? Anybody? Or have we been telling them the wrong stuff?
Everything you said sounded accurate to me. I don't think you said anything incorrect there, Jane.
Okay, good.
So how we help you, and by and large, you have to be a certified Medicare agent and be recertified every year through AHIP. And that Ryan is our subject matter expert on that. We navigate the market for you. We look and see, this is for individual health. If you had dependents or something, we would look for subsidies and things like that. And then we'll take a look at what's available, for you, including your ancillary benefits. And that's if you want to go into Medicare. and Ryan is duly qualified on that. We will help you during the enrollment process. He'll sit down with you and take whatever time is for you to select what you want to do. And then candidly, we don't disappear once you're enrolled. Keenan and AP, we work together. We're licensed in 27 states. We work with carriers. We're appointed with the major carriers up in Oregon, California, Washington, working on Nevada and Arizona, plus California. I don't know how many of you are going to move to California once you retire. Most people seem to be doing quite the opposite. Ryan's our Medicare person, and he can set up time with you individually to kind of walk through your own individual status and state there. The one thing about this, our services are free. We advocate for our customers to help take the confusion out of it. I could send you a myriad of complimentary emails about Ryan and his service, and I don't say that lightly. I've been in this business a long, long time, and candidly, he's one of the best Medicare folks I've ever had to work with. His knowledge and our support. And by the way, once you enroll, we don't abandon you. We're here to help you beyond that point. Sometimes you'll call the carrier, but a lot of times, you know, you'll call us and we're there to advocate for you. We're easy to get a hold of. It's okay to give this out, Amy. And I know I heard Jane said she was recording it. I'd like to re-record it sometime when I don't have all the technical glitches. I'm sorry. But we're there with our toll-free phone number, basically Monday through Friday. And we have online support at our website. And then obviously you're lucky you all have Karen and Amy on top of all that too. So we're here to, you know, work with all of you. I apologize for the glitches. I will tell you that United Healthcare series can answer almost any question you have. They had a video for it. I was on the web for a week trying to find out what I thought was best in that Simplifying Medicare series on YouTube. Just there's a lot of different answers and stuff there. But again, you know, we're happy to be here. And we can continue answering questions. I'll turn it back over to Amy and or Karen to see Jane if we can help out any further.
One more question.
One more question, if you could.
Sure.
Make that two.
Yeah, this is Marty from Clatsop again.
Okay.
Before this meeting was put together by Jane, thank you very much. There was questions I had because I turned 65 at the June 30th. So I have that 7-month window I'm playing with, and I didn't want to stub my toe on this enrollment thing, and no one really had a solid answer. So before this meeting came up, I did some digging around, and I talked to Social Security here in Warrenton, Oregon, and the lady I spoke with has dealt with several Clatsop County staff that kind of went through the same thing as I am about to. And they say if you're not going to quit working and you do have a high deductible and an HSA and you're not going to file for any benefits from the feds, do nothing.
Right.
And then your employer will give you a letter when you do decide to apply for benefits that proves that we were still covered by an HSA/high deductible insurance. Is that still an accurate statement?
And I'll add to that I'm very concerned about the quote unquote do nothing, because I fear that the Medicare enrollment at some point is automatic when you hit that age. The one that's free, I was told that you're automatically enrolled if you don't consciously defer. So
I think that was if you're drawing Social Security benefits.
So if I could speak personally, I will be 68 in August. I have relied 100% on what Ryan's told me, and I have done nothing with Medicare because I'm still on our employee plan. I've never been asked to enroll. I was never forced to enroll. I have stayed on the employee benefit program now for going on 3 years, and I've had no repercussions or anything from Medicare. Am I correct, Ryan?
It's very common to delay your Medicare until you retire, mainly because there's a monthly premium specifically for Medicare Part B. So you can be automatically enrolled in Medicare if you are receiving a Social Security check, but if you're not, then yeah, it's very common to delay getting that. Similar like what you mentioned is once you do retire, your employer can give you a letter or a notice, and that's just basically proof showing that you've had coverage the entire time, so that whenever you later apply for Medicare, you can set it up to pick up just as soon as the employer coverage were to end, and by showing that notice, that's where you can avoid any issues as far as late enrollment penalties or being delayed as far as when that can start. So yeah, it's very common to delay for Medicare until you retire.
Ryan, I may have missed this in the video. So is Part A auto? You have to, or do you actively sign up for Part A?
With Medicare Part A, there's generally not a monthly premium for that, and that does typically go into effect for free and automatically when you turn 65. The Medicare Part B, which is the medical portion, which does have a monthly premium, and that's what it's very common to delay until you retire.
Technically, when I review the IRS HSA rules, it looks like any part of Medicare, including Part A, would disqualify you from funding your HSA pre-tax or receiving pre-tax contributions. However, it sounds like in practice, based on what Sam's saying, is that it's never been an issue for him.
I should say that a couple of years ago, we had an employee who had worked well beyond 65, and he discovered at some point that he had automatically been enrolled in Part A, and it took him months, actually many months, to unravel that and get it straightened out. So that's the concern. Is do nothing really the way to go if you're going to continue with your coverage with the county? Or do you have to notify them, hey, I'm working, I'm going to defer?
And what I would suggest is to get in touch with Medicare. If you do nothing, then, and this is also if you're assuming you're not receiving a Social Security check, they can enroll you automatically in Medicare Part A. So as far as the issue is with contributing to an HSA, and you don't want Medicare Part A and Part B, or either one, absolutely, I would suggest kind of confirming with Social Security to make sure that you're not being enrolled in either, so you don't run into those tax issues. Specifically with Sam, I mean, I don't know his particular plan, but I'm not sure if he has a high deductible health plan like most people with the county do.
And I think that's where the Social Security may not have, when they gave that advice, understood, because if you had a PPO plan, you know, with copays and things like that, there's not as much complexity. When you're in the high deductible plan with an HSA, I would say do nothing is probably not good advice.
So it's answer to call them and tell them don't enroll.
Right.
Or is there a form?
How do you
defer?
Can you tell us exactly how we're supposed to defer? How do you notify them officially?
Yeah, you can notify them, whether it be online or over the phone, or a lot of offices are closed, but you can also do it in person at a Social Security Administration office, but a lot are still closed due to COVID. But yeah, either online or over the phone.
Okay. So we don't have to write a letter. There's not a form, or maybe it's an online form.
Yeah. So yeah, I mean, just by getting in touch with them directly, they'll be able to help you out with that process as far as delaying your Medicare until you retire.
Okay. Terry, did you still have a question?
My wife is on, I have a family plan, and she was considering at 65 starting Social Security while I continue to work. So at that point in time, that would trigger but as long as I took her off of my work plan, I could continue contributing to my HSA.
My understanding is she can still be on Medicare. But I'll defer to Ryan. I think we've had that scenario come up where a spouse was actually still covered on the county plan, but it was also on Medicare as a dependent on a county employee's plan. I cannot remember that exact scenario, but is that possible? If you want to keep your spouse or a dependent on your plan at the same time that they're on a portion of Medicare?
Yes, being on. Oh, go ahead, Ryan.
Well, yeah, I mean, go ahead.
I was just going to say, and let me know if you disagree with me, but being on the high deductible plan itself is not problematic. I think you would just want to make sure that you evaluate what your maximum HSA contributions can be, because I think if you're not covering a family anymore at that point that's qualified, you wouldn't necessarily be contributing the full family amount pre-tax. So there could be some additional complexities that go into that situation from a HSA funding standpoint that we would want to research for that individual.
And it may be since they're covered on Medicare that you wouldn't be able to use the HSA funds for that person? Or can you use them for that person?
I think if they're qualified expenses.
Ryan.
Back to you on that one.
Is Ryan or?
Yeah, was the question just, can you use the funds while you're on Medicare?
So an employee's spouse is turning 65 and going Medicare, but the employee is not and wants to continue the plan. How does that work? Can the spouse still be on the employer-sponsored plan and have Medicare? And if so, which is primary at that point for that person?
The employer-sponsored plan, right, Ryan? If they're covered by that and Medicare, the employer-sponsored plan is usually primary. But if they're covered as a dependent.
Well, yeah, it doesn't really change as far as, you know, if they're on Medicare or not. I mean, that'd be the same as if the employer was on Medicare as well. I mean, it kind of works the same way regardless if it's or if it's the employee.
Yeah, and the HSA distributions would be fine. So you could take money out of the account for that person. The problem, I think, comes into play and why with the high deductible plan, the way it works is deductible first for everything. And so my understanding is if the employer sponsored plan is paying primary and they're on a high deductible plan and they have Medicare, they're still going to have to meet that high deductible and they're not going to get a lot of benefit from the Medicare plan. Ryan, correct me if I'm wrong, but from having both at the front end of the year. Anyway, so they've had some expenses.
A, the free part?
Yeah, that's what I'm. I just wanted to make sure that at that point that I could still contribute to the HSA if she decided to go file for Social Security, end up on Medicare Part A.
Yes, you can contribute to your HSA. Yes.
Yeah, okay. As long as you're not on any form of Medicare. Yes.
Perfect.
Okay. I think we got
long answer to a short question. Sorry.
And I would also say you need to talk to your tax advisor on some of this because that's beyond insurance. Hate to say that.
Yeah.
Well, so many of these circumstances are so individual based on what's going on at your, in your family unit and your home and kind of what your needs are. So we definitely like to do some individual consultation on some things. Tax advisor though with the HSA. They're gold.
I think we're good here in the room. Is there anybody on the call that has a question? You can type it into the chat or just unmute. I can unmute everybody, I guess, but I'm afraid to do that. That could be chaotic.
It looks like we just
Question.
Let's see. Brian Wilson still had his question.
That's not the Beach Boy guy, is it? Oh, you have the celebrity up there?
So Brian's question was, how do we go shopping for plans and find out what things actually cost?
I would say set up an appointment with Ryan and let him walk through everything for you up there.
That's exactly what I help out with, are the individual Medicare plan. So we can absolutely make an appointment based off of your birth date and zip code, and when your Medicare is going to affect, if there's any spouse, their information as well. So that's certainly what I can assist with.
Great, thank you. Appreciate that. Any other questions? I think we're good here.
Jane, I wanted to say thanks and to Karen and Amy for allowing us to get in here. I apologize for the technical stuff, but hey, we're getting there with modern tech, with everything. And again, I refer back to that series on United for a lot of these individuals. There's a lot of videos there to go take a look at.
Great. Thank you. I think this was very informative. It helped a lot. Really appreciate it. And I'm glad we've got it recorded, so I'll publish it out there for folks to review. If you have that slide with your phone number on it, Ryan, or your contact information,
hang on
throw
here.
that up and we'll add that in here just as the last note.
Whoops, there you go. Ryan,
sure.
you have it there. His area code 916-859-7163. And his extension is 4183.
4183.
It's 7160.
Yeah.
Correct.
Say
And
again.
FYI, Ryan works from Kansas. He just moved from California back home, so he's 2 hours off, but he's available to you out here. The West Coast folks, from what times, Ryan?
Like 7:30 to 4:30.
California time.
West Coast time, yeah.
He's on banker's hours back there, okay?
7:30 to 4:30. Yeah, that. Okay, that sounds great. Thank you so much. Appreciate it.
Thank you all.
And thank you again, Karen and Amy, for making these arrangements.
Of course.
This was very cool.
Jane, I can resend you the flyer, the Medicare flyer with Ryan's information and Keenan's information if you want to post it or send it out to employees.
Oh, yes, please. Yes,
Yes.
that would be great.
Of course.
Perfect.
Great. Thanks, everybody.
Thank you very much.
Thank you.
Stay
Have a great weekend.
safe, okay? Bye-bye.